السلام عليكم ورحمة الله وبركاته. Today يوم راح نبدي بآخر محاضرة بالفارماكوكاينيتيك إن شاء الله. نكمل الفارماكوكاينيتيك today the last lecture regarding or belong to pharmacokinetics. Today we're speaking about design and optimization of drug regimes, of dosage regimes. Design and optimization of dosage regimes. To initiate drug therapy, a dosage regime is administered either by continuous infusion or in intervals of time and dose. طبعا, this is depend on various patient and drug factors, including how rapidity a steady state. What is a steady state? شلون نوصل للsteady state؟ الدرج يوصل لمرحلة الsteady state. Steady state is the state at which the rate of administrations equal that of elimination. Steady state, the rate of administration equal that of elimination. طبعا, in this case we reach steady state. The regime can be further refined or optimized to achieve maximum benefit with minimum adverse effect. With minimum adverse effect. طبعا احنا نعرف ان for each drug there is side effect. بس احنا حتى نحصل الفائدة الكبرى البنفيت اللي نحصله لازم يكون with minimum adverse effect. With minimum adverse effect in any regime that the patient takes. It should be with minimum adverse effect. Firstly, we are talking about النوع الأول اللي هو continuous infusion regime. For continuous infusion regime. طبعا, الثيرابي may consist of single administration of a drug, or could be continuous administrations of a drug, which could be IV infusion or fixed dose per fixed time interval regime. And we will talking about each one separately. For example, for single dose, as a single administration of drug, for example, single dose of sleep-inducing agents such as zolpidem, or for continuous administration either as an IV infusion or oral fixed dose per fixed time interval. يعني شنو oral fixed dose per fixed time interval? For example, one tablet fixed dose every 4 hours, which is fixed time interval regime. One tablet every 4 hours, which is fixed dose per fixed time interval regime. Each of which results in accumulation of the drug until a steady state occurs. وإحنا قلنا, what is a steady state? Is the point at which the amount of a drug being administered equal to that amount being eliminated, such that the plasma and tissue levels remain constant. يبقى البلازما والتشو levels remain constant. ليش؟ إن إحنا حتى نحصل تأشير steady state راح يكون the amount of a drug being administered equal the amount being eliminated. مثل ما قلنا, for dosage regime in a steady state, the plasma and tissue levels remain constant with IV infusion and fluctuate around mean in oral fixed dose. وراح نعرف ليش. قلنا مثل ما نعرف إنه بالIV infusion الabsorption راح يكون 100% directly go to bloodstream, while in oral regime راح which undergo metabolism. It will around المين. بحالة steady state for each IV or oral fixed days, sorry, IV infusion or oral dosage or regime, it will the plasma and tissue level remain constant, يكون constant with the IV infusion and fluctuate around the mean in oral fixed dose. طبعا the drug accumulate until a steady state occur. We will explain that in details. How the drug will accumulate until a steady state occur. Okay. For plasma concentration of a drug following IV infusion. Number one, we're talking about plasma concentration of a drug following IV infusion. Following initiation of IV infusion, the plasma concentration of a drug rises until the rate of a drug eliminated from the body balances the input rate. شو يعني balances the input rate؟ يعني the drug input it will equal to the drug output. Here the drug input equal to the drug output, we achieve the steady state. Why? لأن steady state اللي هو بحالة steady state or to achieve the steady state input which is rate of infusion راح تكون equal output اللي هي rate of elimination. بهذه المرحلة نقول إحنا steady state is achieved. Steady state is achieved. طبعا نقول إن the plasma concentration of drug remain constant assuming the drug elimination is first order. أيضا بالنسبة للبلازما concentration for drug following IV infusion before that I want to explain more to let you more understand إن مثل ما أهم شيء نعرف إن the rate of the drug exit from the body مثل ما قلنا increase proportionally as the plasma concentration increase. Okay, here the steady state is achieved in which the plasma concentration of a drug remains constant. Okay, the steady state plasma concentration مثل ما قلنا is directly proportional to the infusion rate. The steady state concentration, this is steady state concentration abbreviation يعني الاختصار للsteady state concentration is inversely proportional يتناسب to the clearance of the drug اللي هو elimination of the drug. Steady state concentration is inversely proportional to the clearance of the drug. Okay, for example, before we give an example, طبعا in case of hepatic or renal disease can increase steady state concentration. In case of hepatic or renal disease in some patients, this can increase the steady state concentration. ليش؟ لأن نحن بهذه الحالة راح يصير عندنا decrease the clearance. إذا هذا تناسب عكسي. نقلل الكليرنس أو الإليمينيشن راح يزيد عندنا steady state concentration. بالعكس if in case of increase الميتابوليزم يزيد الميتابوليزم إذا راح يقل reduce the steady state concentration. ليش؟ لأن any factor that increase the clearance of drug such as increase in metabolism, decrease the steady state concentration of infused drugs. Okay. What this picture show? This picture, which is the effect of infusion rate on steady state concentration of the drug in the plasma. R0, which is rate of a drug infusion, and steady state concentration مثل ما قلنا الابريفيشن مالتها CSS. شنو تشرح لنا هذه الصورة؟ For example, if the infusion rate is doubled, the plasma concentration ultimately achieved at the steady state is doubled. If the infusion doubled, the plasma concentration achieved at the steady state is doubled. ومثل ما قلنا إن the steady state concentration is inversely proportional to the clearance of the drug. Here نلاحظ هنا في حالة مثلا low rate of infusion وهنا high rate of infusion. طبعا هنا in case of low rate of infusion ال RO اللي هي rate of infusion 0 per milligram per minute. هنا عندنا high rate of infusion double عن هذا الانفيوجن for example 2 times. A faster نلاحظ very important note, a faster note of infusion does not change the time need to achieve steady state. الوقت اللي نحصل عليه حتى نوصل مرحلة steady state الريت of infusion ما يأثر عليها. اوكي؟ only شنو اللي يتأثر؟ steady state concentration change. steady state concentration change يعني احنا إذا ضاعفنا الانفيوجن مثلا هنا 2 times هنا عندنا low rate هنا high rate اثنينهم يوصلون لمرحلة achieve the steady state at the same time. But where is the difference? The difference in the steady state concentration. Steady state concentration will be changed, but the time to achieve the steady state concentration, it will be the same. إذن the time to reach steady state drug concentration اللي هو نقول مثلا عندنا the concentration of drug rises from 0 at the start of infusion to its ultimate حتى يوصل لمرحلة steady state. The rate constant for attainment of steady state is the rate constant for total body elimination of the drug. Thus, 50% of steady state concentration of a drug is observed after the time elapsed. Since the infusion T, which is equal to T half or whole half-life of a drug, where T half or half-life is the time required for the drug concentration to change by 50%. Okay. احنا هنا وصل half-life T half. Then we give another administration of drug after another then صار عندنا another half-life. راح يصير عندنا accumulation of drug. The drug concentration approach 75% of steady state concentrations. Okay. هنا راح يصير اعطينا جرعة ثانية. راح يصير عندنا accumulation of drug. For example من الجرعة الأولى صار عندنا 0.5. اعطينا half life ثانية جرعة ثانية راح يصير عندنا remains راح يصير عندنا accumulation another half life. The drug concentration would approach 75% of steady state concentration. The drug concentration is بعدين then the drug concentration between 75 and 90 the drug concentration is 87.5% of steady state concentration at 3 half-lives and 90% at 3.3 half-life. Thus, a drug reaches steady state in about 4 to 5 half-life. يعني هنا يقولون نسبة ثابتة إن الدرج ممكن achieve the steady state concentration after 4 to 5 half-lives due to accumulation of the drug from the first dosage until we reach the 4 or 5 dosage, and this accumulations could lead to reach a steady state in about 4 to 5 half-lives. You will see that in a big figure, which is this figure. هنا خليناها بصورة أكبر حتى نشرح عليها بشكل أوضح، وهنا الشرح مع الصورة. أوكي؟ إذا the rate قلنا the rate constant for attainment of steady state is the rate constant for total body elimination of a drug. Thus, 50% of the final steady state concentration of the drug is observed after the time elapsed since the infusion, T, which is equal to half-life, where T half or half-life is the time required for a drug concentration to change by 50%. Then waiting another half-life allows the drug concentration to approach 75% of steady state. Then the drug concentration is 90% of the final steady state concentrations in 3.3 times half-life. Thus, a drug will reach steady state in about 4 half-life. Here, مثل ما قلنا 50% of the state drug concentration is achieved by T half or half-life, and then after another half-life, then third half-life until reach 90%, with 90% of a steady state drug concentration is achieved by 3.3 half-life. Here in this figure, they speaking about the wash out of the drug. Wash out of the drug. When the drug infusion stop, شنو راح begins wash out. عملية الطرح drugs from the body. Wash out of the drug is exponential with the same time constant as that during drug infusion. At the same time, إذا إحنا عندنا drug infusion or drug input، عندنا drug output. Drug wash out. For example, drug concentration declined to 50% of the steady state level in half-life. But note in time, it will be the same time constant as the drug infusion. Here the drug infusion until reach steady state, stop infusion. This is time for wash out, which we call wash out period. Wash out period. This figure show the rate of attainment steady state concentration of a drug in the plasma after intravenous infusion. Now we're speaking about fixed dose per fixed time regime. Fixed dose per fixed time regime. Here, administration of drug by fixed doses is more convenient than continuous infusion. It will be different. Okay? Sorry. Fixed doses administered by fixed time interval result in fluctuation in drug levels. راح يصير عندنا some fluctuation in drug levels. Fixed time dose regime. Here we're speaking about multiple IV injections, and multiple oral administration. And we're speaking about each regimes separately. In case of multiple IV injections, of course, when a drug is given, here following administration of a drug at repeated intervals, the plasma concentration increase until steady state is reached. Using smaller doses at shorter interval dose does not change the rate at which the steady state is approached or the steady state concentration. Here, when the drug طبعا is given repeatedly at regular interval, the plasma concentration راح يصير increase until steady state is reached. Until steady state is reached. Because most drugs are given at intervals shorter than 5 half-life and are eliminated exponentially with time, some drugs from the first dose remain in the body at the time that the second dose administered, and some from the second dose remain at the time that the third dose is given, and so forth. Therefore, the drug accumulates until within the dosing interval, the rate of drug loss driven by an elevated plasma concentrations exactly balance the rate of drug administration, that is until steady state achieved. This example, the red line injection of for example, of 2 units of a drug once daily. Here, injection 2 units of a drug once daily. This is day 1, this is day 2, for example, day 3, day 4. While the blue show injection of 1 unit of 1 unit of a drug twice daily. This is twice daily, day 1, this is day 2, day 3, for example, day 4. So he injection 1 unit, 2 unit once daily, while injection 2 units, 1 unit twice daily. This is 1 daily, this is twice daily. Curve B, where is curve B? This is curve B, which is show the amount of a drug in body. For example, 1 gram of a drug is administered IV to patient, and the dose is repeated at the time interval that correspond to the half-life of the drug. As we said, at the end of the first dosing interval, 0.5 units of a drug remain from the first dose. When the second dose is administered at the end of second dose interval, 0.7 units are present. When the third dose is taken, the minimal amount of a drug during the dosing interval progressively increase and approach a value of 1 unit, whereas the maximum value immediately following drug administration progressively approach 2 units. إذن عندنا 1 unit of a drug is lost during the dosing interval, which is exactly matched by the rate at which the drug is administered. That is in rate in equal to rate out, as in the case of for IV infusion. That's to say 90% of the steady state value is achieved in a 3.3 half-life. 3.3 half-life. In the case of IV infusion, the drug accumulates until within the dosing interval, the rate of drug loss, that means driven by an elevated plasma concentration, and exactly there is balances the rate of drug administration, that is in steady state, is achieved. Okay, but here, where is it? Sorry. Here, in this graph show predicted plasma concentration of drug given by IV infusion A, twice daily injection, twice daily injection, and then B, this the blue, or once daily injection. This model assumes rapid mixing in a single body compartment and the half-life of 20 hours. Here, where day 1, day 2, day 3. Okay, hey, for twice daily, where each day for the injection 2, which is injection of 1 unit of a drug twice daily injection of 2 units of a drug once daily. And here the plasma concentrations of the drug until reach steady state concentrations. Steady state concentrations. In case of multiple oral administration. Here for oral administration, actually most drugs that are administered on an outpatient basis are taken orally on a fixed dose per fixed time interval regime, such as specific dose taken 1 or 2 or 3 times daily. In contrast, IV injection, orally absorption is slowly. Orally administered drug may be absorbed slowly, and the plasma concentration of the drug is influenced by both rate of absorptions and rate of eliminations. And here, example, for single fixed dose, a single dose of a drug is given orally, result in a single peak in plasma concentrations, okay, followed by a continuous decline in the drug level. While in case of repeated fixed dose, repeated oral administration of a drug result in oscillation in plasma concentration that are influenced by both rate of absorption and rate of eliminations. Now we're speaking about optimization of dose. The goal of drug administration is to achieve and maintain therapeutic response with minimal toxicity or side effect to achieve our goals of administration, as we said, with minimum toxicity or side effect. For example, with careful titration, most drugs can achieve this goal. If the therapeutic window of the drug is small, for example, for digoxin, warfarin, cyclosporine, a plasma concentration range within which therapy is effective will be defined. The dosage required to maintain therapy will be computed and administered as a maintenance dose or loading dose. What is loading dose? A higher dose or series of doses administered to achieve the desired plasma level rapidly. Loading dose, higher dose, يعني جرعة عالية, or series of doses administered to achieve the desired plasma level rapidly. Loading dose is followed by lower multiple doses to maintenance dose. Here for maintenance dose شنو راح يصير عندنا؟ الدرج طبعا are generally administered to maintain steady state concentration with therapeutic dose, okay, حتى نحصل to achieve given concentration, rate of administration and rate of elimination of the drug are important. It takes 4 to 5 half-lives of a drug to achieve the steady state concentration. The dosing rate can be determined by knowing the target concentration in the plasma and clearance, elimination of the drug from the systemic circulation and the fraction اللي هو F اللي هو bioavailability. So, loading dose حتى نعرفها, the dosing rate can be determined by knowing what target concentration in plasma, clearance of the drug from the systemic circulation and the fraction, which is F, absorbed bioavailability. Loading dose is useful for drugs eliminated from the body slowly and hence require lower maintenance dose to keep the drug at a therapeutic concentration. Without an initial higher dose, it would take longer to reach a steady state concentration. Here, so for loading dose, a drug can be, for example, here loading dose, which is apparent drug times desired steady state concentration divided by F. Here, the F, which is absorbed bioavailability. In case of IV administration, load bioavailability 100%. So the equation will be loading dose equal to apparent volume of distribution time ضرب desired steady state concentration. Loading dose might be associated with risk of drug toxicity. ممكن أن توصل risk of drug toxicity. That's why we'll be careful in this case. It could be reached to lead to risk of drug toxicity. This figure shows accumulation of drug administered orally without a loading dose and with a single oral loading dose administered at time 0. Here, the blue line show with a loading dose, while here without loading dose. This here without loading dose, which is a log, the peak will reach gradually to reach the steady state concentration, while with loading dose directly, given the higher concentrations and remain till constant until reaching steady state concentration. Ideally, in achieving the desired plasma level of a drug may be clinically unacceptable. Therefore, loading dose of a drug can be injected as a single dose to achieve the desired plasma level rapidly, followed by an infusion to maintain the steady state, maintenance dose. Here, in this picture shown. But without loading dose, for example, it will go gradually until reach the maximum higher dose, then will go to steady state concentration. Okay, and how we calculate by, as we say, by this equation for loading dose. For in case of IV, because F, it is the bioavailability. In case of IV, 100% loading dose equal to variant drug distribution times the desired steady state concentrations. وقلنا إن loading dose, it is very important ومهمة to require طبعا to achieve the half-life is relatively long and the therapeutic benefit of the drug is required immediately. We have to know loading dose for each drug. قلنا the disadvantage to the use of loading dose include the risk of drug toxicity. Loading dose is most useful for the drug that eliminated from the body slowly. It's important for drugs that eliminate slowly from the body. Such drugs require only low maintenance dose in order to keep the amount of the drug in the body at therapeutic concentrations. Dose adjustment. dose adjustment. The amount of drug administered for a given for the patient, taking into account inter-patient variability and pharmacokinetic factors. So the amount of drug administered is optimized for the patient, taking into account inter-patient variability and pharmacokinetic factors. For a drug with a defined therapeutic range, drug concentration are measured and the dosage and frequency are adjusted to obtain the desired levels. When determining a dosage adjustment, apparent volume of distribution can be used to calculate the amount of drug needed to achieve a desired plasma concentration. How? By which equation? For example, assume a heart failure patient is not well controlled due to inadequate plasma level of digoxin. Suppose the concentration of digoxin in the plasma is C1. This is the concentration of digoxin in the plasma. And the desired target concentration is C2, which is a higher concentration. How can we calculate which dose we need for this patient? Okay, the following calculation can be used to determine how much additional digoxin should be administered to bring the level from C1 to C2. As an equation, apparent volume of distribution time variable concentration 1, which is the amount of a drug initially in the body of digoxin. Apparent volume distribution time C2, which is will give us amount of a drug in the body needed to achieve the desired plasma concentration. The difference between the two values is the additional dosage needed, which is equal to volume of distribution times C2 take away or minus C1. In this equation, we will know the additional doses needed in this patient, the difference between these two, which is equal to apparent volume of distribution times C2 take away C1. Okay, and here in this figure, which show the time course of a drug concentration when treatment is started or dose changed. Here, for example, the plasma concentration during oral therapy fluctuate around the steady state level obtained with intravenous therapy. This is mean what fluctuation around the mean in case of oral therapy fluctuate around the steady state level obtained with intravenous therapy, and this is the red line, sorry, the blue line, intravenous infusion, while the pink one or red one is the oral dose. Okay, until reach the steady state, dosing change, that means accumulation of drug following sustained administration and following change in dosing. That means there is an accumulation. Could be this dosage doubled or halved. Dose could be doubled, accumulation ضاعف الجرعة، أو this dosage will be halved، قللت الجرعة. When doses are doubled or halved or stopped during steady state administration, the time required to achieve a new steady state level is independent of the route of administration. يعني هنا احنا عندنا هنا time الدوزج doubled أو in case of dosage halved قللنا الجرعة. Steady state, a new steady state level is independent. It's not dependent on the route of administration. It is independent of the route of administration. يعني ما لها علاقة if it is oral or it is IV infusion. It is orally or if it is IV infusion. So there will here نعرف إن accumulation of drug following sustained administration and following change in dosing. Oral dosing was an interval of 50%. Any change بالدوزز if it is doubled or if it is halved, it is independent of the route of administration. A new steady state, it will be independent of the route of administration. Thank you for you, and this is our lectures for today. Any question I'm ready to answer, you can send me a comment. Thank you for you, and I hope to fill I send it to you by Google Class. أرجو من الاستمارة التي أرسلتها لكم by Google Class. شكرا جزيلا.